I'm Dr. Joseph Shvidler, and I'm a double board certified facial plastic surgeon currently practicing at the Seattle Facial Plastic Surgery Center in Seattle, Washington. So septoplasty is surgery that involves correction of the midline portion inside your nose. So the septum is a structure that's made out of cartilage in the front of your nose and bone in the back. And sometimes it's bent or deviated. So imagine a sail of a boat. And so when the septum is bent, it kind of bows out into the wind, so to speak. And that may be due to several factors. It may be due to inherent weakness of the septum. It may be due to previous history of trauma. Or sometimes the septum just continues to grow into adulthood, and the growth plates just never stop growing, and they form deviations, or we call them spurs, that project into the nasal airway cavity and obstruct the airflow. The septum could be deviated in the front, and sometimes it may manifest in a difference in the shape or size of the nostrils when it's on the bottom. It could be deviated on the bridge of your nose, and that may lead to external deviation of the nose. This may happen due to trauma or injury, most commonly sports-related injuries, basketball, soccer, gymnastics, people kneeing themselves during water skiing. Sometimes this could be due to congenital reasons. So during birth trauma, somebody's nose could be injured, and as the nose grows, it continues to grow crooked. And so the septum as well as the external nose can be crooked as well. The best thing to do is to come in for consultation and have us look in your nose, or if you have a CT scan. Actually, the posterior or deviations that are further back in your nose are best seen on a CT scan. So if you can send us a picture from your dentist, your oral surgeon, or your other visits where you had a CT scan of your sinuses, may be most helpful. And you can just send us a crop of the picture and we can look at it and tell you whether you have that spur. That may be the best option. So insurance usually will cover septoplasty and any nasal valve repair surgery, but a rhinoplasty component is not covered by insurance. So this would cover the anesthesia, facility, and surgeon's fee for the septoplasty and nasal valve repair portion, and then the cosmetic additions are not covered by insurance.